Well, cardiac disease is one of the 5 biggest killers of Māori, who on average die 7 years earlier than non-Māori. But a new outreach program is expected to be a game changer for Māori cardiac health in the Waikato. The Hāpai Tia Te Hauora Manawa program launched yesterday at Kirikiriroa Marae in Hamilton and is a first of its kind service delivering in-home heart checks through the rohe. Patamahui Leaf Wright is the clinical nurse specialist on the program and joins me now.
Kia ora.
Kia ora. Listen, Māori have some of the highest incidences of heart-related diseases in the country. I don't have to tell you that. How is this program going to work?
Essentially, it's going to help with early screening. Early screening is the biggest thing that we can do to help stop our Māori from dying young, way too young. So it's about getting out there, going to our people, meeting them where they are, and doing that screening to catch anything early. Yeah.
How will it happen? Will people request? Is it on an app? Is it how do you if you're maybe feeling like there might be an issue but you're not too sure?
So our website's up and running now, so you can always self-refer through the website, which is www.hauoramanawa.org. But most of my referrals at the moment have come through partnerships with Māori health providers and primary health organisations out in the community. So they know their communities so well and they know where the need is, and I'm happy to go out and help them.
I guess this will have a big impact sort of in rural areas, right, where maybe, whānau are a bit far away and stuff like that, and maybe we put things like that off because we go, we got mahi, we got whānau, and a lot of wahine Māori, thinking about everyone else, maybe not themselves.
Yeah, absolutely. So, the barriers in accessing healthcare for Māori are so well documented, and we know all about them, and we've known about them for a long time. So it's about time we started doing something to really change the game, and let's rather stop expecting people to come to us. It doesn't work, it's just not working, and those barriers are not going away in a hurry, especially after COVID. The hardships that people are facing is not getting any easier. So let's take the service to them. Let's go and meet them where they are. Yeah.
To give people a bit even me, right, when I think about going to a doctor, I'm like, freaks me out a little bit, right? For people that maybe have a problem, what's it going to be like? Do you know what I mean? What's so someone's going to drive up and is it taking my heart rate? What is it? Just, for dummies, if you like.
Well, I hope that I'm not nearly as intimidating as coming to a hospital for a start. It's in the comfort of your own home or a place that you can nominate in your community. Essentially, I've done it at marae and play centres and all sorts of places, actually, just wherever you're most comfortable. So we take away that really Western environment for a start, and then I like to think it's just like having a good old catch up. So lots and lots of kōrero before I would even start to do any of my assessments, and then some basic assessments. I'll have a listen to your heart with my stethoscope. I'll take an ECG recording, so look at the heart rhythm, and I can do some blood tests right there and then, and I'll get the answers right there and then, which is really cool. And then if need be, we can do an ultrasound of your heart. So I try to keep my approach definitely kōrero based.
This, I'm guessing, could be potentially the difference between life and death for some whānau, right?
Yeah, absolutely. It's scary the number of times I might find something in somebody who's really young, so younger than me, and I'm not very old, someone in their early 20s, and I'm finding something that in the next 20 years' time, they would turn up to hospital probably on death's door and have very limited options in terms of treatment. So knowing that we've found this now, we can keep a really close eye on it and intervene at the right time and save a life is what gets me getting out of bed in the morning.
I guess my last part would probably be, is there an opportunity, do you think, is this a good idea to replicate sort of right across the motu?
I can't see why not. If it works here, I think if you've got the right people willing to adapt their approach and be really agile and responsive to the community's needs, because every community is going to be different. And if if I've spent time in more than one community, what they need and how they need me to interact with them is different. And so it's just being able to roll with the punches, adapt your approach, and be really open to being led. I'm not in charge, they're all the bosses of me, really.
Patumahui Leaf, right? What awesome mahi. Thank you so much for doing it, and thank you for finding some time for us as well.
Nō kui te honore, kia ora.